If you are a new caregiver or you're about to be a new caregiver, then this video is for you. There is a lot that can be said about what it takes to actually do this, to actually be a caregiver. And it's a lot. It's very nuanced. Whether your loved one's coming out of the hospital or out of a skilled nursing facility, they're going to come home with some information. They're going to come home with help, depending on the level of care that they need. For instance, they might need a hospital bed or some oxygen. They're going to have paperwork that's going to detail what happened in the hospital and what should happen going forward, like doctor's appointments. They might even be pre-scheduled for you. Okay, the medications that are to stop or to start, you're going to have that all aligned for you. But the one thing that individuals are not prepared for when it comes to caregiving is how to actually be a caregiver. So a lot of the times people go home and they just fill the role the best that they know how. And a lot of the times that looks like winging it. Now, this leads to a lot of issues, including chaos and overwhelm and disorganization. Here's what you need to know. What you need to know is there are certain things that you're not going to be able to avoid. There's certain heartaches that you're not going to be able to skip over. But there are certain things that you can do before your loved one gets home, just to make things a little smoother, a little easier for you and for him or her, or them sometimes. When certain things are not put into place, and I like to call them systems, okay? When systems are not put in place, when structure is not put into place, it can look like unsure of the details, unsure of what happened in the hospital. Okay, for example, being asked questions, feeling the anxiety build because you just aren't sure of the answer, and feeling that weight on your shoulders, because truly that's what it is. It is weight, especially if the person that you're caring for can't speak for themselves at all. The position that you want to try to get yourself into before you even get started avoids this scenario. Imagine a car driving down the street and it's going 50 miles an hour, okay? And you are on top and you're holding on to either side and you're holding on for dear life, okay? This car is going over potholes and making lefts and right turns, and you have no control over the destination, over the speed, nothing. That's sort of the equivalent of what it's like to step into caregiving completely unorganized, because then you're leaving you're leaving everything in the hands of someone else, of your provider, or whoever is a part of the care team. So the aim is to get in the car. The aim really is to be in the driver's seat. It doesn't mean you're going to have all the answers, but it means that you are the one that clearly has all of the information that will help the providers be able to do their jobs correctly. Okay? More efficiently, really. So what does this look like? This looks like, before your loved one gets home, create one hub, create one place where you're keeping all of the information. Okay? Make it something that you do not have to repeat over and over again. Make it something that you don't have to search for over and over again. One spot, clean. What this does for you is it frees up the mental load inside of your mind. It frees you from that stress, from that angst, okay? From staying up at night trying to remember what the doctor said, or recalling an appointment over and over and over again in your head, okay? Feeling anxiety about whatever is going to happen tomorrow. You don't have to go through that. And it doesn't mean that it's going to eliminate it all, because there are certain things that even organization can't subside, like the overall worry for your loved one. The overall, that's inevitable. Okay, but when you create systems, when you create that structure, when you are prepared, yes, there's definitely a difference. There is definitely a load off. You don't have to go into caregiving with all of that, carrying all that with you. carrying all of that weight. You don't. You don't. I know someone who just not too long ago was a caregiver, and she gave everything that she had. Okay, everything, like 150% of her effort into taking care of her loved one. And what did it wind up doing? Well, there was no structure, there was no organization, and there was winging it, because that seems like the status quo, right? But what wound up happening is she wasn't taking care of herself. Okay. She threw everything into taking care of her loved one, um, all of her concern, all of her time. And it really took a huge toll, not only on her mind, but her body, because she was physically helping. She was helping physically. And it really put a stress on her back. It put a stress on her muscles. It put a stress on her neck. And the anxiety was so high from the worry, from feeling the guilt and the responsibility, from worrying about missing information, or from the anxiety of not understanding what was told in an appointment, feeling like she didn't want to be a burden on anyone by asking too many questions. Okay. And then feeling the guilt when it came time to advocating for not being, feeling like she was informed enough to be able to make these decisions. And if something didn't go the way that she wanted it to go, or even her loved one wanted it to go, the guilt just, it ate her up. It did. Okay. Eventually, she's taking steps to get back to herself. But the point is that going into caregiving, it does not have to be like that, no matter what. And it doesn't matter who you are, where you are, what you know, how smart you think you are or not. Doesn't matter. You do not have to suffer like this when you are a caregiver. There is a way out. There is a way through. Okay. And the bulk of it is in creating one spot, one hub, okay, where you keep all of your information. I hope this video was helpful. We're going to dive deeper into topics. If you're someone that needs deeper input, then leave the word more in the comment section, and I will send you a link so that we can talk one-on-one. Okay. Thank you for watching, and I'll see you in the next video. Bye-bye.